Hello. So today we are with Dr. Kailas Patil, who is a knee surgeon at Sancheti Hospital, Shivajinagar, Pune. He will be answering the frequently asked questions which patients have before undergoing a knee replacement surgery. Hello, sir. Welcome to this video regarding the frequently asked questions about patients' doubt having for knee replacement surgery. So, starting with, I would like to ask you, what is a knee replacement surgery?
I'd like to introduce myself. I'm Dr. Kailas Patil. I'm working as a knee surgeon at Sancheti Hospital, and we specialize in total knee replacements and total hip replacements. To answer your question about what exactly is a knee replacement surgery, it's basically a surface replacement surgery. So, what we do is whenever there is a knee which has been damaged because of multiple reasons, the most commonly sought after reason is osteoarthritis, which you may have heard as Sandhivat or Zamkivat. All these common jargons are used for this disease, and 80% of the patients come with osteoarthritis. Remaining 20% may be traumatic arthritis or rheumatoid arthritis. So, in this, what happens basically is your knee, a normal knee, has a surface above this, and it's a very lubricated and very smooth surface. Over a period of time, what happens is this gets rubbed off, and then the bone touches the femur bone touches the tibia bone, and the knee joint starts getting friction in it and gets rubbed off, and because of which there is a lot of pain inside the knee, as well as there may be deformities inside the knee. So what exactly is a knee replacement surgery is we remove that damaged portion of the knee and fit it with something called as a knee replacement surgery. There is a cap on the femur or the bone which is of the thigh bone, and there is another cap which is fitted below, which is for the tibia, which is the shin bone, which we normally call, and this then forms a knee joint, or this is called as a total knee replacement. So this is basically what a knee replacement surgery is. So it's basically, as I earlier mentioned, it's a surface replacement surgery. So once we replace these portions with this new joint, what happens is the rubbing or the friction which is occurring across the thigh bone and the shin bone, that stops and the pain completely goes away. So what we usually tell the patients is most of the patients get about 100% relief of pain after this operation. Say about 99% patients may have a little bit less less appreciation of pain, say about 95%, but it is not definitely below 95%, and that is the amount of relief which a patient gets, and they can do their daily activities like walking, running, jumping, a little bit of sports activities after a knee replacement surgery. So that basically is a knee replacement surgery.
Okay, thank you. That was quite informative.
Thank you.
So, when should one have a replacement surgery?
See, there are multiple things when we are going for a surgical option for any kind of ailments which our body is suffering from. So what we call usually is, this is not an emergency operation, it is usually an elective operation. That is, whenever the patient is having too much amount of pain, there is a too much amount of deformity, or the patient can't walk a couple of steps on his own or without pain, that is the time when we start thinking about a knee replacement surgery. But before that, we have to understand and clinically examine the patient, where we grade the patient in what exactly condition, what exactly stage the patient is in, whether we can offer him a knee replacement surgery. So there are 4 grades basically: grade 1, grade 2, grade 3, and grade 4. So usually in grade 1 and grade 2, we resort to most of the conservative management, that is exercises, precautions in their daily life. There are lifestyle activities, modifications, and medications, and sometimes also injections. So these are conservative line of management. But whenever the patient is having too much amount of pain, as well as his stage of disease is in grade 3, grade 4, which is the terminal point, that is the time usually when we advise the patient that he should get a surgery done. But all said and done, as I earlier mentioned, it is an elective surgery. So whenever the patient is ready to undergo this surgery, whenever the patient wants relief of pain, whenever the patient wants to walk properly, they want to do their daily activities, that is the time when we offer knee replacement surgery. So it's basically a lifestyle or lifestyle modification surgery which we are offering the patient. So it is that is the time when we tell a patient, okay, fine, you are going to need a knee replacement surgery. But that, having said that, all depends upon the patient's individual want to walk properly, the patient's individual want to have relief of pain, and that is the time when we say that yes, you can go ahead with the surgery. So it is basically dependent upon three things. One is medical viewpoint, second is orthopedic point, and the third is psychological point. And after taking into consideration all of these things, that is the time when we offer a knee replacement surgery to the patient.
Okay. So how long does the artificial joint last?
So usually there was a period when, knee replacement surgeries have come to India. Now it's been quite some time, say about 30-40 years, knee replacement surgeries are being done in India, and Dr. Kailas Sancheti was one of the pioneers of these surgeries, who has introduced this lifestyle changing surgery to India. And at that time, when the joints were in the nascent stages, they were just about being invented, and they were being applied to the patient. The life which were given was about 10 years, 15 years. Later on, after 10 to 15 years, the life increased to about 15 to 20 years. And nowadays, these all changes came because of design changes, and there was much more of technology which was available in making these joints. So technology in the sense, the design of the joint, as well as surgical precision, as well as nowadays you must have heard about robotics. So all these things together, now what we say is the joint can last up to 20 to 25 years, and much more, even much more than that. We have had patients who are having joint replacements done about 27-30 years ago in Sancheti. So that's what we are advising the patient. But all said and done, if you take an average of how many patients we are seeing every day and how many patients are lasting for how long, it's around about 20 years we can take without fail. So about 95% of the patients who have underwent knee replacement surgery with us, they have lasted for about 20-25 years without any issues inside their joints.
Okay, thank you. So can people with diabetes or high blood pressure, even can they undergo the knee replacement surgery?
Of course, that's a very good question. So most of the patients who are coming to us for these kind of surgeries, they are in their their elderly age group, what we usually call them. They are in their geriatric age group, so above 50, above 60 age group. So most of these patients, if we see on a general population, if we take into consideration, most of these patients will be suffering from comorbidities, what we call, like diabetes mellitus, like hypertension, like thyroid. All these things, they do matter, yes, but we have to take into consideration that because these patients are having these diseases, that doesn't mean that they are not going to want to have a painless life, and life without deformities, or life which will be active. So all these patients are categorized as patients having comorbidities. These patients are investigated properly prior to the surgery. We are taking into consideration whether they are having control of, suppose say they are having diabetes, so we take into consideration whether their sugar levels are normal, whether they can sustain those sugar levels even after the surgery, because a lot of times ups and downs do happen after the surgery, but we take into consideration all those things. Second thing is, in cases of hypertension, blood pressure, we do all the investigations necessary, including the 2D echo, as well as dopamine stress test, which is one of the ultimate tests before any patient goes for any kind of a surgical trauma. So all these things we take into consideration, and then we subject the patient to surgery. It is not like the patient comes and we say, okay, fine, you need a surgery, and the second day the patient is taken for surgery. For example, nowadays patients are, as you all know, it's COVID time, so most of the patients are along with all these tests for diabetes, blood pressure, sugars, we subject them to RT-PCR also. So we are not leaving any stone unturned before the patient is subjected to a surgical outcome. But that doesn't mean that the patient with diabetes, hypertension, other comorbidities cannot undergo surgery, of course they can go. If you want to put a figure on it, almost about 80% of the patients who come for these kind of surgeries do have comorbidities like diabetes, hypertension, and we take care of them. So that's how it goes about.
Thank you. So how long does this surgery last?
See, basically what we usually say is surgery timing is dependent upon two things. One is the roll-in and the roll-out time, or the second is patient being shifted from the wards and back to the wards or the ICU depending upon patient's condition. So the roll-in roll-out time, which we usually say, is round about 45 minutes to 1 hour for one surgery for one knee. If it is going to be both the knees, then it's going to be 2 hours. That is the roll-in roll-out time. So what is a roll-in roll-out time? Is patient going inside the theatre and coming out of the theatre. So that is the amount of time which is required for the patient to undergo anesthesia, undergo the surgery, undergo stitches, and then dressings, and the patient comes out. So that is roll-in roll-out time. So give or take, it's round about an hour. If you take a point that the patient goes from the ward and comes back to the ward, so that can be relative. It depends upon when the patient is going from the ward to the OR, and what time is the anesthetist going to say that okay, fine, this patient is stable enough that he can be taken to the ward. So that can range between 6 to 12 hours. So that is the time when the patient's relatives will be able to meet the patient. So roundabout we say, whenever the patient is going to be, whenever the relatives are going to ask us how much time is it going to take, so we usually give an average time of about 3 to 3.5 hours, so that before they can meet the patient. So that is roundabout what we should take. But in our terms, in the surgical terms or in a surgeon's term, it takes around about 1 hour for the surgery to last.
So this is a doubt which every patient and relatives have, that
Yes.
when can a patient walk after the surgery?
Yeah, that's a very good question. So what we usually say is this operation, what I usually tell my patients is, this operation is not an operation where we are going to mend what is broken. We are going to replace it completely. So there is a new joint which is going to come in. So after this is done, the patient will be able to walk the next day itself. So that is how fast you can make the patient mobilize. There are also some somewhat what we call as 0-hour surgeries. So in these cases, what we say is 0-hour surgeries are basically what happens is, immediately after the anesthesia wears off, the patient can be made to walk depending upon his pain tolerance. Most of the patients who are undergoing what we call as partial knee replacements, that is only a part of the knee which is replaced, these patients can immediately walk within 2 to 3 hours after the surgery. And this all depends upon how much the patient is going to tolerate the pain, because pain tolerance is a subjective phenomenon. So most of the patients who can tolerate quite a lot of pain, they can immediately walk. The patients who are a little less tolerant to pain, they need to be given certain medications. But all said and done, on an average, a patient needs to be walking and up and about in 12 hours to 24 hours.
Okay. So doctor, when do the stitches are removed?
See, basically what happens is, in any surgery for that matter, you must have heard in your childhood that you got a cut and there were stitches put which were removed after 8 to 10 days. But in this case, in a knee replacement surgery, it is a dynamic joint. So there is a lot of pressures and a lot of forces which are acting across the joint. So roundabout what we say is, we remove the stitches by about 14th day. In cases where the skin is very fragile, in cases the patient is very old, or in cases where the wound healing is a little slow, in these cases we can delay it up to 21 days. So round about 14 to 21 days is the time when we remove the stitches.
Okay. So after the surgery, does the patient need a walker or a stick support?
Yes. So most of the times what happens is, when we replace a joint or we remove and put in a new joint, what we usually talk in medical terms is proprioception. That is your body's inherent ability to understand what any of the joint is doing at any particular time. So whenever we replace this joint, whenever there is a new joint which is coming up, in those cases this proprioception is lost, and because of which the patient needs some kind of supports. They may be a walker support, a stick support, or some kind of ambulatory devices, what we call. So what we usually advise the patients is round about 2 weeks of walker support, which may be a static walker or a mobile walker. And the second, after those 2 weeks, depending upon the, again I'm saying, depending upon the pain tolerance of the patients, we start putting them on a stick support, which has to be a tripod stick support. That is, it has to have at least 3 supports below the stick, so that the patient doesn't slip and fall, and he can very well put his whole load on the stick. But most of the times, give or take 2 weeks of walker, and after that about a month of a stick. That is the amount of time the patients are going to need any kind of supports.
Okay. So when does the patient need to come for a follow-up after the surgery?
Usually what we say is after 15 days, that is when the patient is up for a stitch removal. That is the time when we call the patients back to the hospital to see how the wound is doing, how the stitches are. If the stitches are good enough, we take out the stitches and call the patient after the stitch removal, say about a month after that. And that is the time when we do the x-rays, the first follow-up x-ray. If everything is going as per the schedule, we ask the patient to come after 2 months, then after 3 months, so on and so forth. So we go on increasing. It's going to be escalating after that, the amount of follow-ups the patient is going to have. Round about in a year, the patient will come for follow-up for about 4 to 5 times. That's the maximum amount of times the patient has to come for follow-up. After 1 year, what we say is the patient can come after 6 months, and then after another 6 months. Once the 2 years are over, that is the period of time when the patient may have some issues or any kind of problems he might face in those 2 years. And after those 2 years, if everything is going on smooth and as per our expectations, as per the patient's expectations, we call them after, say, about 5 years, 10 years down the line.
Okay. So how long after the surgery is it necessary to take the medications?
Yes, that's a very good question, because most of the times when we tell the patient that you are going to require a knee replacement surgery, we tell them that this is so that you stop taking medications for your pain. You stop taking medications for other issues which you're suffering because of the knee joint. So most of the times after the surgery, the patient is given painkillers or anti-inflammatories, which we call, depending upon the pain, depending upon the pain tolerance, depending upon the swelling after the knee replacement surgery. As per the patient gets better, these medications are cut down. If the patient is on any kind of diabetic or hypertensive medications, those will be continued, and they will be continued as per what the physician or the MD doctor of the patient has advised. The antibiotics per se, we don't believe in giving too many antibiotics, because it's not really required. After first or second shot of antibiotic, the patient his immunity takes over and takes care of the body itself. And too many antibiotics are also not good for your health, so we cut down after the first 2 or 3 doses. In cases where anti-inflammatories are given, it depends upon how comfortable the patient is. See, the whole aim of giving medications is to take care of his pain, to take care of his comorbidities, as well as to take care of his general well-being. So in cases, as long as the patient starts feeling better after the surgery, as long as the patient is going to be happy about the surgery, say on a pain scale, say on a VAS scale, say about patient is better by 6 or 7 upon 10, the patient should be alright, and we just take him off all the medications which are orthopedic point of view. His physicians, his medical point of view medications may continue.
Okay, thank you. So this might be a very frequently asked question for you, that when can one be allowed to drive after the surgery?
Yes. So most of the times what we say is driving in our scenario is quite important, because we don't have that much access to public transport. So we try and put the patient back on track as early as possible, but day-to-day activities he can start doing after 2 months of surgery. And driving, we usually give them or allow them to drive after the proprioceptive part of the knee starts getting back into place, that the patient starts feeling the new joint. So that's around about 3 to 4 months down the line after the surgery that the patient can start driving a four-wheeler, and that should help the patient.
Okay. And when can one be allowed to travel after the surgery?
Oh, traveling is quite a relative thing, because most of the patients who are coming to any kind of these kind of surgeries, they come from quite long places. They come from abroad also to our hospital. But in most of the cases, what we say is that assisted traveling, you can do immediately with somebody to look after you. You can take the walker stick and then just you can travel. Uh, per se, if the patient wants to travel on his own, that he can do after 2 months, and he can very well go to the bus station or railway station or the airport. And only thing is that whenever these joints are replaced, what we usually give is the patient is given a card which says that the patient has an implant inside. So whenever he is going at airport or any kind of places where there is going to be body screening, these cards need to be there with the patient. So that is very important in cases where the patient is coming from abroad or coming from faraway places, who has to air travel or something. Those is the cases where we have to give these cards, and we give it at Sancheti, that this is an implant card which is quite valid at any of the screening posts.
Thank you. So one last question I have, which is the most important one, that what restrictions need to be followed after one undergoes a knee replacement surgery?
So that's a very good question and a valid question. So there was a time when we initially used to tell the patients that you are not allowed to do basically two things. One is to squat, that is sitting cross-legged on the ground, and the other is to use Indian toilets. So most of the times what we say is, in these cases, these are extremes of movement which we really don't expect that new joint to happen. But with the new technology, with the new surgical precision and expertise, these knees are able to perform all the activities which a normal human being can do. But all said and done, what we want is the joint to last a little longer. So we avoid the patient, we tell the patient that you should avoid these two activities basically. Initially there was we used to tell the patient that you are not supposed to carry heavy loads, and you are not supposed to play, and you are not supposed to do any kind of heavy activities. But nowadays what we say is, you can do your regular activities, you can do involve in certain low contact sports activities also. That is also not a problem. Only thing is that if you can avoid sitting cross-legged and using what we call as Indian toilets, and use Western commodes for their daily activities. And that is the only two restrictions which I think are applicable to patients undergoing knee replacement. But it's not a hard and fast rule that they have to follow, because even if we tell them, if they are going to an outskirts place, because you know that most of the population coming to us is from villages, and they don't have access to these kind of luxuries. So most of the times we tell them, either you build it or you get it constructed at your place, or you can use a chair for your daily activities, or but most of the patients, they really don't follow all these things, and they will go home and do these activities. But as a part of a surgeon, or as a part of a orthopedic knee replacement surgeon, I usually tell them, avoid sitting cross-legged and using Indian toilets. So these are the two things which they have to follow.
Okay, thank you, Dr. Kailas Patil. That
Thank
was
you.
quite informative. I am sure that whoever has a doubt about total knee replacement surgery, you
Yes.
have cleared almost all of that.
Yes. So
Thank
I
you so
just
much.
want to add one thing, that whenever a patient comes, we give these booklets to them, where there is a brief introduction to what is he suffering from and what are his issues, and then we also give them what their surgery is going to include, what they are going to face, or what their surgery is exactly going to be. So this is a total knee replacement brochure, where we are going to explain to them in brief what the surgery is going to be, how they are going to face, and how they are going to go ahead with the surgery. So all these brochures are given to the patient, and they will, even if they go home and they have any questions about their surgeries, they can very well go through these brochures, as well as we give them our numbers, so they can really contact us and have a one-to-one access to us, so that we are able to help them in any which ways possible, and allay their fears about this knee replacement surgery.
Thank you so much.
Thank you.